Hey guys, I wanted to do a quick update since I haven't done one in a while. My computer has been broken for the last couple weeks or so and I'm trying to fix it. I may have to get a different computer or maybe a tablet or something like that. I don't know. I don't really have the money to buy a new computer right now. Anyways, so I wanted to give you a fertility update, and I'm going to try to do these videos when I can, when I have something to update, given the fact that my computer's not working. I'll do the best I can, but we did another round of the fertility medication. This time the nurse suggested that we just do the gonadal F-pen, the gonadotropin injections, and I don't know why. I was trying to get an answer as to why we're doing it like that instead of having me take the Femara, which kickstarts your ovulation. Instead, the gonadotropins just give the hormone to grow your follicles more and stimulate the follicles. But I didn't really get a clear answer out of her, so I figured they know what they're doing. But they doubled my dose from the previous time that I did it, and my husband and I thought that it was a lot since things seemed to progress well with the dose I was on. I don't know why she didn't just bump it up a little bit or just stay with the dose that I was on, but she said she felt like I could be a little more aggressive with the medication, and lo and behold, she hyperstimulated my ovaries. I shouldn't say she, but my ovaries became hyperstimulated, which means too many follicles got stimulated. It was like 5 or 6 that could possibly mature, and so they told me that they would have to stop the treatments right now, and we'll have to possibly take a month off or so to let my body recuperate. So I was really sad about that. I was really hopeful, and that's more money we would have to spend. And luckily I spoke with the nurse about their maintenance fee charge, and she spoke with the doctor and they agreed to waive my charge this time since they only did half a round, and so I would pay the next time I would do another round. So that was very, very, very nice of her to do that. You know, I'm sure they don't always do that, but I really like the office people and the doctor a lot, even though I feel like I wish that I could get more of a clear answer, and I feel like the nurse is a little bit of a scatterbrain, but I guess I don't really have a choice right now, so I feel like I'm gonna continue with another round when I can. So I went for a follow-up ultrasound since I got my cycle the other day, and I called the nurse since she told me to call her whenever it starts, and she asked if I could come in right away just for a clearance ultrasound to make sure and see if there's any more follicles in there, or if there weren't any follicles, she said we could go ahead and continue with another round over again. So they did the ultrasound, and it looked like about 1, maybe 2 follicles on each side that could still be there. And from what I can understand, the nurse told me to go ahead and do an ovulation predictor kit on my day 11 of my cycle, and if I have a surge to call her and then to continue like we usually would. And she said that she's been doing it for a long time, and some people can get pregnant off of the remaining follicles that are in there, and you can kind of like you ovulate twice pretty much in a month. But like I said, with me having the polycystic ovarian syndrome, I don't know. I'm not holding my breath. You know, it would be really awesome if I could do it naturally and not have to do another round of these hormones, but we'll see. I've been praying, and I'll cross my fingers that maybe it works, and that I won't have to do it again next month. So that is the update on that, and whenever I have any other kind of news, I will let you guys know. Feeling a little frustrated. Just as a little side note, I've been doing my own research and on the internet, and it kind of stinks that I don't really have a primary care physician with the military doctors right now. They haven't assigned somebody to me, and it's been probably about 6 months, and they said they're still waiting for somebody to be assigned. So I'm seeing whoever's there, and I did some research on polycystic ovarian syndrome, and they recommend that you do a glucose test to check your insulin resistance, because that can be another problem with polycystic ovarian syndrome. That basically it's very similar to diabetes, where you can also be predisposed to get gestational diabetes, and my insulin resistance may not be quite there. So I went to my primary care doctor and explained the whole issues that I'm having. I'm seeing the infertility doctor. I did some research, and the infertility doctor suggested that I have my primary care physician do the test for me. So he just did the blood test, not the one where you drink the glucagon sugary syrup, which I don't know which one is the most accurate, but he agreed to do the blood test. He just kind of shrugged his shoulder, and he was like, okay, you know, like I know he didn't know anything about the polycystic ovarian syndrome, but I'm glad that he didn't put up any fight or question me or anything. I pretty much just asked him to order that, and he said he would run a full panel, check my vitamin D, because a previous doctor had checked my vitamin D and said it was very low, and also he's going to check my thyroid, since I changed my dose a little bit according to my endocrinologist. So hopefully I'll get those test results soon, and if I have any other updates, I will let you guys know what's happening on that front. Alright, I hope you guys have a good week. See you later. Bye!